Welcome, everybody, to another edition of Dietitian Career Success. I am Stacey, your host, and today I have with us a very interesting guest. I'll tell you all about her. She is a pro at nutrition informatics, something I believe that all of us should get a little bit better at. So please welcome Julia Oblein.
Stacey, I'm excited to be here.
Thank you so much. You and I met via social media on LinkedIn in particular. I always like to point out LinkedIn because I think a lot of folks are thinking that, oh, maybe that's not like an area. Maybe that's just an area for if I'm looking for a job or if I'm trying to get found by a recruiter. But really, it's how you can have these great collaborations with other dietitians, with other healthcare professionals. So that's how Julia and I met. And I actually think that we may have met a couple years ago at one of the food nutrition conferences. And I forget where it was, but we met, I think, in 2023, and you were on a panel giving a talk on the topic of the new malnutrition, the impact of staff and supply shortages. So let me just give you a little background on what Julia does. She is the Corporate Director of Malnutrition Programs at Morrison Healthcare. She's got 15 years of experience in healthcare administration, and she's had the opportunity to work on lots of projects related to malnutrition, regulatory compliance, and nutrition informatics, where she's been very involved in leveraging software to improve project management. We'll talk all about that, and outcomes, which we're going to talk a ton about. So she's been very involved in discovering innovative informatics solutions to enhance malnutrition. So Julia, thank you so much. How did you get?
I was very fortunate, and I took a lot of opportunities that came my way. So I had an interesting background. Again, I started in a little bit of long-term care, did some time in healthcare administration. My passion always was in more of acute care, and I took an opportunity with Morrison Healthcare about 10 years ago, and I've been with them. And I've been involved in their malnutrition programs and developments early on for the last 10 years and collaborated with the team through various things. And I was fortunate enough to be able to join the corporate team as a program manager a couple of years ago, and then just recently moved into the director position. So I've been heavily engaged and been able to kind of participate from the ground up of the development of our programs and got to see them in different aspects. So I've rolled out malnutrition programs as a CNM, then spread that as a director of nutrition systems across a system of hospitals, and then now get to support all over the country. So it's been a really fun process.
I'm so impressed with your upward mobility and how you've sort of leveraged one position to move into the next. I'm just in awe of all that you do. So maybe take a step backwards and tell us a little bit about why we should be, as dietitians or contract food service companies, be tracking malnutrition in the first place.
So I think it's a great opportunity for us to contribute to the field and really tie some outcomes with what we're doing. So I have a strong passion for malnutrition just in general related to patient care, just being in acute care hospitals and long-term care environment, just seeing the impact. So that alone on the patient care side kind of drove my interest in it. But then I really saw how sometimes it's often hard for dietitians to quantify all the work we're doing. And malnutrition is a great opportunity for us to quantify what we're doing and show success and progress and how we contribute to hospital success and those kind of metrics. And so I think it can leverage us to gain seats at the table to help be more impactful globally with the work that we're doing.
I think you're right. I think that's like the key to everything is really quantifying what our impact is. We always talk about that we are worth more or that we're very valuable and that we're needed for a lot of different things. But I think having real data and real outcomes related to patient care, but also revenue, I think that's really helpful. When we are tracking malnutrition in an acute care setting, how is that related, or is it related to hospital reimbursement or revenue? Is there a connection?
Yeah, malnutrition is one of the few areas where there's ICD-10 codes directly associated with it. So you can track impact on DRG based on different payment models. So from that, it's very easy to quantify. And then from there, some of the things I love with the work that we do is we can further dive into it, into impact on length of stay and readmissions, and how our work with malnutrition can also tie into those patient outcomes that also have, as indirect but direct, relation to reimbursement and revenue hospitals receive as well.
Yeah, that's awesome. So you work in a facility and you work for a contract food service company. I'm thinking about another dietitian who is turning around these ideas in their brain right now, thinking, wow, is there a way that I can bring this to my facility? I'm in a tiny little community hospital, or I'm in a really gigantic teaching hospital. How can dietitians take what they can maybe learn from you, from others, and bring this into their own departments or to their own hospital? Or do you have any steps for success for this for other dietitians?
Yeah, I mean, I think the biggest step is a lot of times we can speak to why we're doing and what the impact is or what is important, but we can't drive specifics. So I do think the first step, if you want to go down this, is figuring out what you're doing and how you can track it. Like the wonderful part of electronic medical records now is everything can be trackable to some degree, but a lot of the work we're doing has to be intentionally built for tracking to support those needs. And I don't think dietitians tend to work in that wheelhouse as much. They don't think of like, how am I charting? You know, we think of the outcome, how we're communicating to providers, to the next person, but we're not thinking of how we're doing that, how we're collecting that data. So I think if you want to start a program, thinking of what you're doing and coming up with your baseline to be able to speak to like, what am I going to do to drive results of this program to get the support from leadership? So I think that's step one. Like if you want to build a malnutrition program, if you want to build steps to improve it or any other program, you have to state your case, right, to gain the support and the leverage with whatever you're wanting to do. So I do think that's one important component.
So I would imagine that you're working really closely with the IT department or medical records, or what departments are you most aligned with?
So, but all of the above. Our hospitals work very close with the informatics team to build the reporting structures and the clinical nutrition managers to help drive how we're capturing data, how we're documenting. Also for collaboration with team members and efficiency and workflows. So we work with the informatics team for those pieces, but we also work with the medical records, HIM, and coding and clinical documentation for all of those pieces as we're working through driving malnutrition tracking and diagnosis and coding.
I think one of the reasons I wanted to interview you is because I have an affinity for this. When I was an outpatient dietitian, when I first started, I got really into working with the IT department and looking at reimbursement codes for this little program that I did, this outpatient program that I did. And I remember thinking, like, I love all this well, it wasn't called informatics then. It was just, I forget what it was called, just like the technology department. I love this more than I actually like working with the patients, like getting into the numbers and watching the reimbursement. You know, it takes a little while. There's a backlog. It was like a few months, I think it was, before you start seeing the benefits of your work. And it was so rewarding and so satisfying and so amazing to be able to then take to not only at the time, my food service director, who then could take it on to the person that they were reporting to, and like how satisfying that was to really demonstrate like why I can continue this particular program. So I love that. So not only are we talking about money for the hospital, but you're talking also about staffing and how that can impact staffing. Can you talk a little bit more about that?
Yeah, I mean, I have firsthand experience when I was a clinical nutrition manager. One of the many reasons that kind of drove, I mean, I love malnutrition, but I also love informatics and data tracking and just all of those pieces. I think information tells an amazing story. So one of the things we were struggling with was staffing, and I was trying every angle with why we need more staffing, and none of it was hitting home. And so we really dove into our malnutrition program. And as I was pulling that together and I was tracking the results of it, I really used that to leverage an argument for staffing. And we were able to add 2 full-time dietitians to our staffing that we had been spending years. So I think, you know, and staffing is just one component, but you can really use that information to leverage a lot of other things you're wanting to do. So I think there's a lot of value there with your, you know, your arguments of what you're trying to move forward with.
Yeah, congratulations on that. So not only can you help the hospital, but you can improve the quality of life, the work life for everybody on the staff and bring on more dietitians. So that's awesome. Congratulations. I am curious about what's the day in the life of Julia? Like what is your sort of a typical, you know, summarized life look like from a work perspective?
Yeah, so it's very different than it used to be, but I work from home and I'm very fortunate. So I'm fully remote, but I spend a good portion of my day in various meetings. So we have accounts using our software and our program all over the country. So I might be meeting with hospital systems all over the country, talking to them about malnutrition and why we should be doing the work that we're doing with this. I have a team of malnutrition program managers that also support the hospital. We do a lot of work on training and resources and building the software. So we also, one of my favorite parts, and I feel like a potential, if I ever took a second career, was working with our developers that design our software. And we work with developers all over the world. Our product owner is actually in Canada. Some of our developers are in India, and it's really fun to collaborate with them and turn the visions of us as dietitians, what we're thinking through, into the software. So that we spend a lot of time building that, testing that, enhancing it. So that's kind of, every day is a bit different.
Yeah, I think I would imagine so. All right, so I can already hear you're very skilled at lots of different things. If a dietitian is interested in moving into this area or exploring it a little bit more, tell us a little about your skills that you already have. Maybe like, well, I already know that you're like sort of a go-getter, but talk about some of the skills that you're sort of born with and maybe some skills that you learned along the way that could be helpful for other dietitians to sort of get into this area.
Yeah, so I think a couple of things, like I think one of the biggest things I would say is taking every opportunity that comes your way. You never know what's going to be of interest. And I've learned so much. One of my favorite things of Morrison is we're so large that sometimes I'll volunteer on different things and I'll learn things that I didn't even know I wanted to learn just from exposure to different things. So I think that's been really wonderful. Some of the things I feel like that for me working in informatics were really integral is skills with Excel or data collection and those kind of things. So I spend a lot of time on YouTube. I'm not a huge Instagram person, but I watched a ton of videos on how to use different platforms. I love like Teams and tracking and data and Smartsheet. And I just learned how to use them to be able to quantify the work that we're doing. I mean, even now with the program we're doing, we're always selling like why we need the program and being able to speak to what we're doing and what the outcomes are. So I think for me, those skills have become very handy. And oftentimes when I'm interviewing for different things, my expertise in those areas can set me apart a little bit. So depending on what direction, if you have skills that you think might be valuable or set you apart from the next person, I think those can be really important to help add your little niche, but also define who you are.
Yeah, I think that's helpful. You reminded me that one aspect of LinkedIn profiles, a way to help yourself get noticed or stand out a little bit is to demonstrate your skills or your skill ability and upskilling. And Excel is a really great one. I think even sheets are helpful, but I think Excel in particular, a lot of corporations, companies use the Microsoft Office suite, and Excel is the program. And I know that there's a ton of resources out there that can teach you how to use Excel. There's this person on, I think it is actually Instagram or TikTok. Her name is Miss Excel. And so she teaches kids and people all about these great basics about how to use and leverage all that you can on Excel, but on LinkedIn. So you can add that skill to your work experience. You can add it to your skills section. You can also take an assessment to earn a skills badge specifically for Excel or for another program that you might be using, or, lots of different ones. So I want to make sure everyone takes advantage of that. And then does it help? Another question, then does it help to understand like your hospital system's EMR, like their medical record system, like Echo or whatever it might be? Does that help in this process as well?
100%. So depending on what area you want, having a good understanding of like the EMR, what you can build, taking the initiative to understand concepts. And a lot of time networking through opportunities like LinkedIn and everything can also help. I know in dietitians, sometimes we get siloed by what is available for us to use in the EMR, and providers and nursing may have other uses of the application that aren't always shared with us or not thought that we might think they're useful. So you don't know to ask often if you're not exposed to them. So I think understanding what the opportunities are and then showcasing what you can do to build off of those is really important. I've always worked in Epic, and I spent a lot of time. I was actually, a colleague and I were the co-chairs of a nutrition informatics committee for our system. So we got to learn a lot about it, about Epic. And even in my day-to-day operations now, I use so much of that information when I'm helping support hospitals that don't know that they can do all these things in those platforms.
That's interesting. I hadn't even thought about that before. So that's really helpful for others as well. All right. Tell me, I love to hear all the enthusiasm in your voice and all the success that you've had. What advice do you have for dietitians who are interested in this area of nutrition, of being a dietitian? What advice do you have for them to be as happy and successful as you?
Well, I would say, be open to every opportunity that comes your way. Explore different things. And then kind of as you learn more about things, really hone in and drive your skill set and grow what sets you apart to continue to grow your career. If you love this area, there are so many, I have learned about so many different dietitian roles in nutrition informatics that I would have never known existed. And there are some that, some that are in the food operations world, some that are purely software development, not always have any kind of relation to directly what you would think with a dietitian. And so I think, the opportunities are limitless. So in my world, and when I was in clinical nutrition management, I learned more about informatics working with them. And like you said, I loved it. And the more I learn about it, the more there's opportunities for roles that fit my passion that I wouldn't have even known fit some of my passions. So I think spreading your wings and learning more about taking those opportunities to network and find out what kind of things are out there that speak to the things that you love. You don't have to step away from clinical if you love clinical, but you also love nutrition informatics. You can create these kind of jobs now. And there's so much opportunity in this world right now with these kind of roles. It's kind of an exciting time to really be innovative in it.
Yeah, it is such an exciting time. I totally agree with you. And there's also the dietetic practice group, Nutrition Informatics, that I totally think everybody should be a part of
100%.
because it's really helpful. Yeah, I'm a member. I think it's a really fantastic practice group and it's the future. I think it's really helpful. Yeah. All right. I always like to sort of bring it all together and talk about money as dietitians. What's your thoughts on how dietitians can make more money as dietitians?
I think as dietitians, we're typically a very driven group. We are very self-motivated and we love to do a good job. And I think sometimes we're afraid to push the envelope when it comes for asking for more. We're very respectful. We're very, understanding. But I think we need to be comfortable in those areas where we know our worth and we can speak for it. I have always been a huge proponent, and I'm very thankful of my dad and my family for always encouraging me to stand up for and be comfortable speaking to what I think I am worth. So I feel like when you're in a job situation and you're in negotiations, that comfort, being uncomfortable, but willing and brave enough to be able to speak to what you think you deserve is number one, very important. Number two, I think you have to have a why. Like your why needs to be solid and your why needs to not just be, I do a good job. You need to have specifics. What have you done? Again, what sets you apart? What have you brought to the table before? What can you bring to the table that's different than the next person? That's why you deserve X, Y, Z. So I think framing the case is important and then having the guts to do it, practicing it 100%. I have never taken a first offer. At one of my very first jobs, I did take a first offer, and the next day I went back and said, I'm sorry, I'm not comfortable with that. And I went back and it was the president of the company. It was one of my roles as healthcare administration. And he said, wow, I can't believe you did that. But he gave it to me. And he said afterwards, I had a lot of respect for how brave you were and how much you said why. So, I think there's something to be said for doing it tactfully. That maybe wasn't my best move, but I've learned a lot through that of advocating for myself.
I just gave a talk at the California Dietetic Association on the topic of salary negotiation. And nobody is really good at negotiations in these compensation conversations because we just don't do it that often. But B, they're expecting it. It's totally normal. I think it's it's a reflection of what you're going to be like in the job. Are you going to be a go-getter in the job or not? You don't have to ask for something that's not within the market value of that position. But I think just having that conversation is empowering, but it also shows that you're going to be a solid employee. You're going to be good. As long as, like you said, you can demonstrate what your value is and why you're aligned with what this proposition is that you're bringing up for the compensation. I think that's great. Yeah. So Julia, thank you so much. Those were wonderful pearls. I know everyone's going to love hearing and listening and reading all that you have to offer here. So I think, are you okay with other people connecting with you on LinkedIn?
Definitely. Yeah.
She's on LinkedIn. I'll give you guys the information down below. So again, thank you so much, Julia, for your insight. First of all, for your work in our profession. Obviously very valuable for staffing, for reimbursement, and bringing this information to everybody inside our profession and outside our profession. So thank you for that. And then also thank you for being here with us today. So appreciative.
Thanks for having me. It's been a pleasure.
Awesome. All right, everybody. Bye for now.